if you have a scoliosis brace, how long do you have to wear it for? For the treatment of scoliosis, bracing has been around for many, many years, for many decades, in fact. In fact, it's one of the oldest treatment options for scoliosis, using a different type of scoliosis brace. And braces have evolved over the years in terms of their design and how they're used and and what the goals are and specific nature of the brace. And good news is that technology has helped a lot in us developing better braces. First thing is, what's a scoliosis brace? There's many different types of it, and they're typically worn around the body, and the goal of these braces can have many different approaches, meaning the design of the brace is going to dictate what the outcome is going to be with that brace use or that brace treatment. The first goal is traditional bracing. Traditional bracing is what I like to call is the current state of orthopedic bracing. And the current state of orthopedic bracing tends to be with either Boston braces or Providence braces or these braces. And these braces have two main categories, one that's used all day long and one that's used only for night. These Providence braces, these braces are nighttime only braces. They tend to squeeze and kind of bend the body. And the goal of this brace is just try to slow down the progressive nature in a very specific category of progressive adolescent idiopathic scoliosis. That's what it's used for. The Boston brace is now not a bending brace. It's now just worn standing. It can be worn 24 hours a day. It can be worn all day long. And it's designed to squeeze the spine and do the exact same thing as a Providence brace does or a nighttime brace does. It's trying to slow down the progressive nature of adolescent idiopathic scoliosis, and it's only used to try to slow down the brace. The opposite type, it will be something called a corrective brace. A corrective brace is no longer just trying to slow it down, but it's designed in such a way to try to produce forces into the body to actually try to reduce a scoliosis. ScoliBrace is a very common one that's used, and it's the kind of brace system I use in order to get the very best corrective style brace. The difference between traditional bracing and corrective bracing: traditional bracing is just trying to slow down progression. Corrective bracing is trying to reduce the curve. That's really the main difference in the goals here. Scoliosis braces, they work for all types of patients, especially corrective style bracing. When we look at traditional bracing, they're typically only used in that one category of adolescent scoliosis progressing in this rapid progressive stage. They normally don't recommend traditional bracing for adults. They normally don't recommend it for infants, and they very rarely recommend it for juvenile cases. For adults, adult cases are progressing slow, very, very slow, maybe 1 degree, maybe 1.5, 2 degrees a year. So the person will have to wear the brace full time forever, and therefore to slow down this slow progression anyway. How much slower are you going to make 1 degree of progression? So that's why they're not recommended. For infants and juvenile cases, these cases tend to progress very rapidly and they have a long time of progression. So trying to slow down this 10-year or 12-year time frame of progression is not successful. So therefore these types of braces are typically not prescribed because they can't be worn for that length of time for that long to have an impact, so they normally fail. In adolescent cases, they're progressing rapidly for 1 to 2 years in this rapid stage. So therefore they feel like, if we can slow down this rapid chunk of progression, hopefully they can come out and not need surgery. In the corrective style, braces can be used in all those categories. We can use them in adult stages, we can use them in infants, we can use them in juveniles, and we can use them in adolescents, because the goal, we're using the brace not just to slow down, we're using the brace as a tool, a therapeutic tool in the combination of what we're doing in scoliosis reduction center treatment to help correct and reduce the curve. And all 4 of those cases, adults, adolescent, juveniles, and infants, would all benefit from curve reduction, because when you reduce the curve, you just don't slow down progression, you actually start dealing with the causation of what's making this curve progress over time, because we know size of curve is the number one factor that dictates how much your curve will progress. So when you reduce the curve, you make an impact on how much it's going to progress and the rate of its progression, which is much stronger than just trying to slow it down. When we wear braces, how do we wear them? How long do we wear them? How many months or years do we have to wear them? Well, every case is very different, like I mentioned, in those 4 groups in terms of adolescent, infants, juveniles, and adults. However, generally, if we're looking for curve reduction, we're shooting for more of a full-time type of treatment, and this can be 18 to 23 hours, depending on the patient's curve size, location, where it is, age, and goals. And we're looking for, in adult patients, we're looking for more pain control. We're looking more for 4 to 6 hours a day, just trying to control pain and deal with, slight postural changes and improving. But basically, we have full-time and we have kind of part-time. This middle ground, which gets recommended very often in traditional bracing, like this 14-hour or this 16-hour a day kind of bracing, I don't know what that's for. I mean, either you're trying to reduce the curve or you're just trying to reduce pain. I don't know what this middle group is, and my guess is because since they know their brace isn't going to reduce the curve, they're just trying to slow it down. What I guess they're thinking is, what's the least somebody would have to wear to try to slow it down? That doesn't comprehend in my model, in our model here, in trying to reduce scoliosis curves. So therefore, it's not a recommendation I normally give patients, because we're either reducing or we're controlling pain. We're not like just trying to slow it down, because most of my patients want their curve to be better. They just don't want to make it, they're just trying to slow down the worsening. How long do you have to wear a brace in terms of actually having a benefit? Meaning, how many months do you have to wear it? 1 month, 2 months, 2 years, 3 years? And first thing is, if you're in this progressive stage and you're an adolescent, it's really dependent on where you are in this age category. If you're in a rapid progressive stage, meaning you're progressing, you have to get through that stage before we can take your brace away. So most adolescents are wearing braces until they're done growing. And the reason why they're wearing it until they're done growing is because at any moment, if they go through a growth spurt, the curve can progress again. So we have to get them through that stage. Okay, that's number one. In the adult stage, typically patients are wearing it based upon their pain level and how much it helps them. So normally they can wear it at a higher dose for anywhere from 6 months to 12 months and getting weaned out into either completely out or into a maintenance dose. So for adults, it's 12-ish months or so. They're actively trying to reduce the curve and reduce pain levels. However, it could be a little less, a little more, depends on the patient. So very simply is, if we're using the curve to reduce, we're using the brace to reduce your curve in a progressive stage because you're growing very quickly, we're wearing it until you're done growing at some level. If you're in the adult stage, it really depends on what our goals are. If your pain relief goals, it could be much more short term. If your goals are more reduction, stabilization, posture improvement, reducing the curve as much as possible, it could be a little bit longer. But on average, we say most patients are wearing braces minimally 18 months at some level to get the change and then getting weaned out. Okay, that's a general rule of thumb, but it's not that simple in all cases. Braces work very, very differently based upon the design of the brace. So it's only going to work as well as it's designed. And I kind of talk about like a car. Like if we look at a car, race cars are designed for speed, right? And they're built low to the car, they're built low to the ground. They have good grip tires, and they're built to maneuver and handle corners. And the design of the car is built to go fast over a smooth surface. However, you take that same car that is ultra performance at smooth surfaces, and you put them on a rough highway or a dirt road, and you put them, have to try to go up a mountain. Well, that car is not designed to do that. You would have to get like a truck with big wheels and has big suspension so it can handle the bumps and unevenness. The design of the car determines how well it functions in any different environment. Well, it's the same thing too with braces. Traditional braces tend to be only trying to slow down progression. They're designed to do that. They're not designed to reduce the curve. They're not designed to address the three-dimensional problems of scoliosis. They're not designed to do that. So you should never expect a traditional Boston brace or a Providence brace or a nighttime sleeping brace to actually produce a reduction in the scoliosis, because that's not what they're designed to do. However, corrective braces are designed very differently. They're designed to actually try to push on the spine and actually reduce the curve in all three dimensions, meaning in compression, in bending, and in rotation. If a brace doesn't have that in its design, it can never produce that outcome, because just like a race car can't go over a rocky road because it's not designed to do that. It's not efficient at it. It just can't do it. So if you're going to be wearing brace, you want to choose your brace appropriately for your outcome goals. If you want to reduce the curve, you have to choose a brace that's been shown to produce a reduction in scoliosis versus one that just at best is going to slow down the progression. If once you choose your outcome goals, you can choose the right brace. And then if you match the brace with appropriate rehabilitation, exercise, and therapy, you can bring out the best in that brace, because most braces even the best design braces need some rehabilitation and therapy to help that brace work better. And then lastly is how that brace is managed. No brace is ever designed to last the life of somebody's scoliosis, meaning the person is being treated, they're being reduced, they're being managed. You have to manage the brace to match the scoliosis. If we think of braces on people's teeth, nobody goes in and gets braces on their teeth and come back 2 years later and their teeth are straight. The orthodontist is managing the patient by tightening the braces in appropriate places, changing the wires, moving clamps, doing all these different things to get the very best reduction possible. The same thing should happen with your scoliosis brace. Your brace should be managed. Every 90 days, we're making adjustments, we're adding pads, we're bending the brace, making it more aggressive, pushing where we want to push, relieving pressure where we want to relieve it. And the goal is to try to manage that curve to get as much reduction possible. The style of the brace, the proper management, and the associated rehabilitation typically determines your outcome. If all three of those things are done properly, your brace can be very powerful in producing a very corrective reduction. If those things are not combined properly, a brace, even a well-designed brace, may not produce the outcome that you want. So we recommend that you choose wisely and make sure all those factors are considered in your scoliosis treatment. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.